So I see that we're in a transitional period in history where people with mental health problems are having their voices heard for the very first time. Just like Martin Luther King in the 60s talking about black rights then. If he was a white person talking about that, nobody would have listened to him. So this is vitally, vitally important and welcome with open arms. If you look at the statistics closely though, you'll find that mental health patients had the lowest response rate, 42%, and 88,000 out of the 300,000 people, the adult inpatients who were consulted, they excluded consulting the psychiatric inpatients. So I think if you actually go to the grassroots level, that you'll find the situation, the real statistics are actually worse. And I'm on the government side, and I know that it's one hell of a job to look after all these people, and people need help. But really, it's a lot more complicated, because you have to realise that when you experience manic depression, like I have myself since the age of 17, you have to realise that it's not something that people want to talk about. So people with mental illness, because it's such a taboo in society, they are not going to respond to surveys.
From your own experience, do you feel that, obviously patients throughout not just with mental health but with other problems as well, maybe have communication problems as well with staff in hospitals and healthcare workers. From your own experience, do you think mental health patients are treated differently in that respect? Therefore, you're more at the bottom of the pile?
I think it's difficult to say exactly, but certainly my experience of mental health hospitals, I've been in 5 different hospitals from the age of 17 to 25. And I'm 29 now, and I've experienced very, very bad care and very good care. When I was at a point though, 4 years ago, that I was so angry with society and the way I'd been treated in certain instances that I had to write an autobiography called A Can of Madness about my own experiences of hospital. Because if I hadn't written that, I would have committed suicide. Now, what I would recommend that the government does as regard to NHS training staff, the way that NHS training staff need to be trained needs to be completely revolutionised, and it needs to be people's first approach. It's all about communication skills, and this is something that's seriously lacking within the staff on the ground level. This has to be brought in at the beginning of mental health treatment, not just in patients but in psychologists and psychiatrists as well.
Okay, Jason Pegler, thank you very much indeed for giving us your experiences on that.